New reports out today provide an inside look at the health of Colorado hospitals.
New requirements mean more insight into the finances of the healthcare industry, including what's coming in and what's being put back into the community. As your investigator Karen Morfitt reports, while profits continue to grow, so too do expenses.
After years of operating in the dark, hospitals across Colorado are now required to disclose more information than ever before.
If we can drive the optics that helps individuals understand and the communities understand what's driving the cost, then we can drive the solutions.
Kim Bimsteffer is the head of Colorado Healthcare Policy and Financing. The department lawmakers have tasked with increasing hospital transparency. Financing Director Nancy Dolson has been digging into the data.
More of the healthcare spending goes to hospitals than anywhere else.
Hospitals are now required to report income, costs, and for nonprofit tax-exempt hospitals, how they are meeting their community benefit requirement. The report shows in 2022, 46 nonprofit hospitals invested 7.2% or $1.2 billion back into the community. It jumps to 15% when you include the shortfall from Medicaid reimbursement. Tom Rennell, the VP of Financial Policy for the Colorado Hospital Association, says that number is growing.
This year we're seeing a 50% increase in uncompensated care compared to last year. That's driven largely by the Medicaid re-enrollment program, where Medicaid patients have lost coverage and are now becoming uninsured. We also, early in the year, we also had a lot of migrant activity, and they weren't able to pay for services.
New reporting requirements break down how hospitals are spending their mandated community benefit dollars. More than half, $721.8 million, went into programs addressing provider recruitment, education, research, and training, compared to $283 million that went to reduce cost healthcare or charity care, which is different from Medicaid and felt largely by one hospital, Denver Health.
Start with a message of thank you. And I think each hospital would say they're doing their fair share. I think if you ask Denver Health, and we have, Denver Health is taking on a lion's share more than anybody else by far.
While the state report found patient revenues grew by more than 4% in 2023, Rennell says more current data points to a different shift.
Revenues and expenses were the same, so zero margin. What that means, margin, I think of it as savings. So that's no savings, no investment for the future.
As part of the transparency reports, hospitals must include salaries for top paid staff at each hospital, but not those who run an entire hospital system. More information, Bimsteffer says, could help paint a bigger picture.
Are they being incented by their board of directors to drive the right behaviors that drive results for the communities that they're in service to? Or are they being incented by the board of directors to drive bigger market share and acquisition of more physician groups and bigger profits and more revenues?
Jade Kelly, president of hospital worker unions at both Denver and UC Health, believe the information is long overdue and still not enough.
We have seen some immense progress in that realm, and I think one of the areas that we have seen some shortfalls is the lack of teeth.
Kelly hopes that hospital transparency is something everyone is paying attention to.
If you are a patient, which I'm guessing you are, being a human being, we all require healthcare at some point, you should care about this.
I'm Karen Morfitt, covering Colorado First.
The public will have an opportunity to take a closer look at the information in the reports, as well as ask questions at a public webinar, which will be on February 13th. We have all the information about how to register online at cbscolorado.com.